Okay, so our group here is comprised of myself, Abby Burns from Hedrick Medical Center in Chillicothe, Abby Hake from St. Luke's South, and Lizzie Accurso, also from St. Luke's South. Our presentation is going to be about providing information about the larger St. Luke's hospitals to patients, visitors, and families. Our PICO question here, the P that we had was patients, family, or visitors. Our I is to provide written and verbal information about larger St. Luke's hospitals, such as the Plaza and North, to visitors of patients being transferred there. Our C is patients, visitors having little to no information available about the hospitals or having to find the information themselves, whether that be through GPS or online. The O is improved patient and visitor satisfaction as evidenced by improved HCAHPS scores, specifically the scores that look at whether a patient feels like their visitors or family were included in their care. A little bit of background here on why we chose this project. Patients that are being transferred from smaller hospitals to the larger ones within the St. Luke system, such as the Plaza and North, are often critically ill and requiring a higher level of care or more specialized care in general. Their families or visitors here are already pretty stressed and worried about the patient and have pretty high anxiety, specifically, older generations or those that aren't quite as tech savvy with using a GPS or a phone to get to these bigger hospitals. Something that seems small, like where to park or how to get there, could add a lot more anxiety to their plate during this time. So if there's anything that we can do to lessen it, we for sure wanted to look into how to do that.
First article is Rural and Urban Differences in Determinants of Patient Satisfaction with Primary Care. This article compares rural versus urban areas using patient satisfaction and found that overall rural areas are less satisfied than urban. And this is relevant to our project because it's important to recognize the differences of the rural and urban areas and how they view healthcare differently. Second article is Perceived Quality of Nursing Care and Patient Education, a cross-sectional study of hospitalized patients in Finland. This article compares the relationship between patient education and quality of care perceived by patients and found that there was a positive correlation between a patient's perceived quality of care and the amount of information and education given to them. And this is important to our project because it shows that the nursing education and providing patient with as much information as possible is important and impacts their overall view on healthcare.
The article here is titled The Creation and Evaluation of a Preoperative Education Website for Hip and Knee Replacement Patients. This study, basically they took a look at creating a website for preoperative education versus the traditional route of patients receiving education, which would just be the nurse providing either verbal or some written information via pamphlets. They figured out that patients really didn't have much of a statistical difference on the amount of knowledge or usability for the website when they surveyed them. However, the patients reported a self-perceived increase in knowledge, and the nurses reported that it was more efficient. So we can gather from this study that a website being used could be beneficial, but it's not entirely necessary in all situations.
What we used was the usability of a chronic kidney disease educational website targeted to patients and their family members. This study was to determine how effective a website would be. And so by doing that, they gathered a group of people of different ages and different literacy levels. And they had them test out the website, and then they surveyed them later. And overall, the patients and the family members surveyed that they found it was easily accessible and they were educated after using it. This would be beneficial to St. Luke's South, I think, because our population is more geriatric and they're not always the most tech-savvy patients. And so an easily accessible website or even app, I think, would benefit them when transferring to other entities. are to provide the patients with written and verbal information about the hospital they're being transferred to. This could include different things like maps on how to get there, where to park, how much parking costs, and then visiting hours of the different units.
And if you have any questions, you can email us at these emails below.